Okay, so I was not able to contact Atia, so hopefully she will be joining soon. Just get rid of those. Oh, here she is. Good morning, Moses. So good morning, Atia. Or good afternoon.
Hello, hello. Sorry about that. I'm going to rename myself. That would be my executive assistant's name, who was into my account for me. There we go.
Well, thanks for joining us. So the meeting, okay, so the meeting is being recorded. Thank you so much for joining us, Pep and Atia. We have really excited to have you today. We've been, so this is a series on resilience that we are doing as part of the Hazard Mitigation and Resilience Plan. For those who are joining us for the first time, the University of the Virgin Islands, in collaboration with VITIMA, which is the VI Emergency Management Agency, we've been working on the update of the hazard mitigation plan for, I would say, 2 years now. So we are in the final stages of putting the plan together. But as part of this effort, we really want to make sure that, you know, this concept of resilience and this concept of what does it mean to live through disaster, rebound from disaster, being able to function and recover real quickly after disasters, those concepts, you know, are well sort of understood because they are very complex, very difficult to grasp. So we've been learning a lot as part of this effort, us on the VI and VITIMA part, and we are continuing to learn. And so today I'm really excited to have two practitioners who've been dealing with this in the front line, trying to take all these theories, all these good plans, all those good ideas that people put on paper and imagine that, you know, it just can be done real quickly, trying to turn those into reality. And really excited to have Dr. Pep Bardoui. Pep is resilience lead for IFC. She was previously the Chief Executive Officer for the Climate Resilience Execution Agency for the island nation of Dominica. She was leading the design delivery of comprehensive action plan to advance the advancement of Dominica's bold vision to become the world's first climate resilient nation. Prior to that, she was also working at IFC, the World Bank, and working in different countries, trying to think about this issue of how to better integrate some of the work of public entities and working with private sectors to try to ensure that people have access to the services that they need when they want it. So we're excited to have Pep with us and have her share some of her experience and insight wearing all those hats, but also trying, as I said, to put plans into action when she was working at Dominica. And now we're excited to hear what she's up to now that she left that position. The second speaker is going to be Dr. Atia Martin. She is currently the CEO and founder of All Aces Incorporation. It's an alternative to traditional diversity, equity, and inclusion consulting firm. Her personal mission is to unleash the invisible power that every person and organization has to intentionally act to disrupt oppression. So a lot of what she's working on is actually quite time sensitive, because a lot of those issues for the past 2 years are now in the front line. So it's nice to know that Dr. Martin has 20 years of experience in applying the principle of racial equity and social justice during her career in resilience, emergency management, public health, and intelligence. So Dr. Martin, we're excited to have you as well and share your experience trying again to put all those very theoretical concepts into reality and affect change. So without much further ado, I will let Pep speak first, and then maybe a few Q&A, and then Atia, he will talk afterwards, and then a few Q&A, and then a general discussion where everybody can share their thoughts, exchange thoughts, ask questions, etc., etc. Just wanting to make sure that I introduced the lead of this project, Dr. Kim Waddell, who is the lead for the Hazard Mitigation and Resilience Plan project. He's also the director for VI EPSCoR. So he's also wondering about how to link research and action on a continual basis, wearing those two hats. So Kim, do you want to say a few words?
No, thank you, Greg, for the introduction. Like you said, I'm really excited to hear our speakers because you and I have wandered in the wilderness of abstraction and concepts, and yet how to make implement some of the ideas that we've gained from our stakeholders into action here in the territory. So hopefully the guidance we hear today will inform some of the work we're doing. But let's just get started. And again, thank you to our speakers for joining us today.
Thank you. So Pep, take it away.
Thank you very much indeed for having me. I just actually sent a note to Atia to ask if she would like to go first, because I think given her background and her profile, it may that may be an interesting place to start. But
okay, that's fine.
But no,
Atia, are you
answered yet.
First?
What do you think, Atia?
I'm happy to do whatever makes sense to the group.
So go ahead, Atia.
I'd say start, because I think I might actually be piggybacking on what you have to say, and that would be, I think, a nice thing. Please go ahead.
Thank you so much, Pep. I appreciate you. And thank you, Greg and Kim, for hosting and inviting us into the space, the sacred space where you all are trying to work through real challenges and problems in communities. And for full context, I was blessed to be deemed a pracademic by a colleague back in the day when I was Chief Resilience Officer. Actually, before I was Chief Resilience Officer for the City of Boston, I was the Director for the Office of Public Health Preparedness, and I had just finished my doctorate program. And so I had just done all of this research on what are the categories of people who are most vulnerable to emergencies and disasters, right? Right now, when we look at the full list of everyone that could potentially be vulnerable, we actually see a pattern that it's a really long list. And by the time you finish with the list, it's like, well, that's everybody. So how do we focus our energy? And the research actually really talks about something that's pretty obvious, which is, well, it's the more categories you fall into, the more vulnerable you are, because people don't just fall into one category. The other piece is that there's certain categories of people who tend to be in a category that's connected to lots of other social categories of people. So people of color tend to fall into multiple categories of what we call social vulnerability in the community. When I'm in other spaces, I tend to refer to it as priority populations, to help people rethink, to challenge people and to help people rethink why making sure that people are centered and why certain realities of people are centered in these conversations is important, mainly because we don't do it by default. In an absence of centering people who are already marginalized in our communities, who are underestimated in our communities, what we're oftentimes doing is making their life harder. We're perpetuating inequities when we don't do that, right? We create policies, we create programs, we create approaches that ultimately, without this consideration for the different realities that people are in, will leave them out or have them bearing the disproportionate burden of the pain and suffering of whatever implementation of that policy or program is. And so I'll talk a little bit about that today. But in the context of resilience, what I've learned over the years from emergency management world in being a part of the response for the Boston Marathon bombings. And so all of my things are beeping. Sorry about that, y'all. But all of my experience during that time really has been about, as I'm trying to talk and turn this off, let me stop pretending like I can multitask. I'm gonna do one thing at a time. Excuse me one moment. There we go. Sorry about that. So what I've learned kind of during that time and being deep in emergency management and having to lead the public health and healthcare response to a disaster and several other disasters before and after that is that most of the problems that we experience are built on top of the problems that we have today right now. So the disaster, the emergency that we're facing that is requiring us to have resilience in the first place is built on our foundational realities from day to day stuff. So when we have people who are disproportionately burdened by oppression and therefore the problems of society, they're going to be disproportionately burdened by the problems when there are emergencies. The infrastructure that is crumbling today, right now, is the same infrastructure that's going to fail when we have emergencies and disasters. The environmental problems that we have today, right now, that people are fighting to address in their communities are the same problems that are exacerbated when we have emergencies and disasters. So today and what happens when there are disasters are intricately linked. They're so intricately linked that it's oftentimes surprising that we intellectually know these things, but in practice, we don't necessarily incorporate that into how we think about resilience and from a practice perspective, what we actually end up doing. We know it intellectually, but as we all know, just because we know something doesn't mean that we're able to do it, right? We know that smoking is bad for us, but people still smoke, right? So these are the realities of being a human and being a practitioner and trying to navigate through a lot of this hard stuff. So some of the things I'm going to show you really are about connecting the dots between, to what was mentioned earlier, some of the theory and practice of what it looks like in real life. And I know I don't have a lot of time, so I am going to say one more thing and then I'm going to jump in. And the one more thing I want to say is oftentimes when we're talking about resilience, we are thinking about the non-human stuff, as I led with. And part of the challenge with that becomes when it's time to implement and people jump up and say, ouch, hey, that thing, this approach doesn't help me or is actually harmful to me, we have a hard time sometimes seeing it and incorporating it into how we adjust and adapt things that we thought to be true, assumptions that we had, versus the complexity of reality. And so part of this is a human thing that is about managing ourselves and our assumptions about what we know to be true about other people's lives and their experiences and how it plays into the ways that we invest in resilience building initiatives and what is best for people. We actually need people to be a part of the conversation because they're the context experts and we're the content technical experts, right? And in absence of both of them being a part of the framing of the problem, all the way through to what we do about the problem and how we move forward, we're missing half the picture. We only have part of the story when we don't have that context expertise from real people who this is their life, right? So that said, I'm going to do the awkward Zoom thing where I do the screen sharing and it takes me a couple of seconds to get to the right window and all that good stuff.
And I'm checking that you can share, so you don't ask me, can I share?
Already done. Appreciate you, sir. So I'm going to jump ahead and I'll put my contact information back up here shortly.
So just, Atya, just sorry to interrupt, you are sharing your second screen, the one with the two slides. You're not sharing the main slideshow.
My bad. I'm fixing that right now. Appreciate that. Holding me accountable. I'm going to do it right this time. Okay, how'd I do this time?
It's good. Thank you.
All right.
Great.
Perfect. Thank you for that. So I'm not going to get into this for the sake of time about the work that my organization does. I will say that I will mention the vision quickly because it's important, and I am a values and vision driven person, and so is the organization that I run. We're a firm of about 10 full-time employees, and we have really the work that we do is about supporting resilient people and organizations with the humanity to foster belonging, the humility to learn, and the hope to envision and create a more racially equitable and resilient world. So that's what we're anchored in. And I'm going to skip ahead to these other pieces. And all the work that we do, you can find it on allacesinc.com or intentionallyact.com. So I'm going to skip ahead to get to the meat of this. So a lot of the work we do is with organizations of diversity, equity, inclusion, and really our focus is on racial equity and social justice. And that's for organizational work. We also do a bunch of special projects where we're bringing together resilience and racial equity principles into planning processes, engagement efforts, community engagement efforts, all types of different work, research projects. And for the purposes of today, I'm really going to center on this, the climate and environmental justice within the context of resilience. And why social equity. And so one thing I mentioned earlier is this idea that people really are not necessarily our focus when it comes to dealing with emergencies and how we build resilience. And so the challenge for us really is how do we recenter people in this context? And as part of that, shifting how we think about resilience to really be centered on this more holistic systemic approach. So although we're talking about environmental justice and climate justice, this really is a much broader definition of resilience from the resilience nerds like all of us who are saying there's this whole much larger concept around resilience. And so it's an ongoing practice, right? So if we think of it as a practice, that means there's stuff that we have to do that equitably improves the ability or capabilities. And capability is an intentional word because it means that you have the knowledge, skills, tools, resources to do something. And that is centered on kind of people, communities, organizations, and systems. So this gets to the multi layers of life and reality and the fact that we live in this kind of this bioecological situation, whereas people are not islands unto themselves. We live in communities, we live in environments, we engage with organizations, and all of those things are part of larger systems. And we need those larger systems to be able, and we need ourselves and everything on that spectrum of that model to be able to thrive in the face of the immediate challenges that we have in our lives, in our communities, with our infrastructure, with the environment, all the way to the things that are ongoing. So the immediate stuff, usually disasters, the things that are unforeseen, usually not completely unforeseen, but we wouldn't know when they would happen. And as well as the ongoing challenges that are the day-to-day struggles that communities are dealing with across the spectrum of people, stuff, environment, and organizations. And the idea is that we're able to see where are we today right now with the challenges that are priorities. How do we identify where we would like to be based compared to where we are? And what are the specific ways that we're going to close the gap between the two, not just for the sake of bouncing back to some previous state, but to leverage these moments as opportunities for transformational resilience, meaning that we're going to connect the dots between these day-to-day challenges and these kind of disaster, climate change related challenges as we're building things out, as we're making investments to mitigate, as we're rebuilding after disasters, our goal is not just to return back to normal, because as we know, normal doesn't work for a lot of people in our communities. Normal is a day-to-day struggle. Normal is people being left out of things, out of decisions, out of resources, and out of their particular considerations and needs being met as part of how collectively we move forward. And in every society internationally has groups of people who fall into these categories. And so the goal is that we're being intentional about how we build resilience. We can't claim to have a resilient anything, a resilient city, a resilient organization, a resilient community, if we are not taking into consideration all the different components of that community, organization, city, to build resilience, right? We can't claim resilience if everyone doesn't have what they need to be a part of the process and to benefit from the resilience that we're claiming to be building. And so for Boston, I'll give you some context on how this plays out in real life, and then I'm going to land the plane. So in Boston, when we look at vulnerable populations in our communities, we see a pattern where they're geographically located because there's a history there. And every city across the world has a history of why people live in different neighborhoods in communities, and therefore are more vulnerable to some of the environmental challenges from climate change, but also the day-to-day struggles that they deal with and how those are worsened. So in Boston, when we think about social isolation, which is not data that you're going to find in the census for the United States, you'll find this is a composite of older adults who live alone and single parent households, which the literature has as two of the most vulnerable populations that you can have for lots of different reasons that we don't have time to get into. But that said, they're mutually exclusive and create a particularly specific pattern that follows a series of other patterns that I'll show you here shortly. So when we map these populations, this is what we see in Boston, and you'll see this Roxbury, Dorchester, Mattapan, Hyde Park area being a central concentration. The darker the red, the more highly statistically significant the concentration of people are in those areas. And then the darker the blue, the lower statistically significantly, the least statistically significantly concentrated they are in those areas. So if we look at where children are geographically located, it's in the same areas where we see a lot of social isolation and single parent households, where we also see a lot of low to no income. And then we get into some other areas of the city where there are high concentrations of immigrant communities in Boston. Then we also get to people with disabilities, right? People who across the whole range of disabilities, from physical to sensory to cognitive, the whole range. This is where they're geographically, statistically significantly concentrated, same areas. And some of these other little light areas are housing developments in the city of Boston. People of color, where are people of color most statistically significantly concentrated? In these same areas. And so you have a confluence of things happening all at the same time. You have particular identities being concentrated, and then you have people who fall into multiple categories being concentrated in communities. And for us, when we think about infrastructure in Boston, the way we make mitigation, where we've been focusing our mitigation efforts for many years has been on this area up here. We've done a lot up here to address climate change impacts. The focus is on flooding. And so folks are all in this area, which, as you can see, consistently are the places where the most vulnerable people are not located. And so there's been a lot of work to advocate to get more focus on what's happening down here with the day-to-day issues like infrastructure and environmental justice issues people are already dealing with, but also how we make investments in infrastructure that improve the access, that improves participation in decision-making, that improve the ability to benefit from whatever investments that we make out of these processes. So that said, What I won't do is go into this. I'm going to skip ahead a little bit and say, land with this approach, and then I'm going to be quiet. So one of the ways that we can develop policies and programs and initiatives is to think about a generic population. What's going to work for everyone? And when we say what's going to work for everyone, what we're really saying is what's going to work for the common denominator. And what we're really saying is what's going to work for people who already have resources and power and we're already paying attention to in communities. And that's called a universal approach. So most of the time we're creating things that have this universal approach. The challenge is that doesn't match reality because there is no monolithic group of people in communities, even within one race or ethnicity, or even within the disability community. There is no monolith. And so in absence of having the context about the different challenges that people are experiencing across all of the resilience domains, then it will be woefully inadequate. And so an option that we have is to use targeted universalism, right? Where, yes, we look at, well, what are we trying to accomplish for everyone, right? Because we want everyone to benefit from the work that we're doing, but also we need to look at, well, if we're looking at this goal for everyone, which we have a SMARTY goal, and by SMARTY, I mean the SMART that we always talk about, specific, measurable, achievable, all those things, and equitable. And so for the second piece, we're going to look at, well, if we know that we have these goals we're trying to accomplish with a mitigation effort, then what does it look like for different people, communities that we're trying to serve, right? So what does it look like for everyone across communities? And then what does it look like for different populations within the communities that we're trying to support? And this gets to disaggregating data by race, by disabilities, whatever ways we can disaggregate it up front. And if there are some things that we can't disaggregate, then that becomes an action item for us to figure out what needs to change so that we can make sure that moving forward data is disaggregated. It's not enough to say that that's just how it is. There are things we can do to shift dynamics of things. And so adding that to the process. And then we want to make sure that we understand for each of the different folks who we know are disproportionately burdened in our communities, we want to see what is in their way of being able to reach the goal that we're setting. So if we're saying we want everyone to be protected from floodwaters, right? And the overall population is, 60% of people are currently protected. And when we look at, I'm going to go with the theme of race at this point. And if we look at people of color in the community, and even if we disaggregate and look at different races and ethnicities, we'll start to see a pattern of, well, for this group, it's actually only 40% of people are protected. For this group, it's only 30% of people who are protected. So what's in their way of being protected, right? Is it an infrastructure issue? Have they been a part of the process? How are we looking at the data about the impacts of flooding in that area? What language are the materials in that allows folks to get access to certain resources to invest in their homes or to have their landlords invest in things? And then lastly, to be able to implement the customized strategies and approaches that are needed to address the different needs of different groups. So all of that to say that there is this very meaningful way of looking at, from the beginning, the ways that we decide to implement infrastructure initiatives, environmental initiatives, social related initiatives, all the way to economic initiatives around resilience. That is harder and better. It's harder because you have to be intentional, and it's better because then we can actually say that we're working towards resilience that is accessible to all the people in our communities. And so the last piece that we have an opportunity, aside from kind of that very process-oriented piece, is I'm not going to go through all of this, but I will say that the way we define the problems that we're trying to solve for need to involve community, so that we have the full context on the problem we're actually trying to solve for. So there's the obvious part of the problem, and then there's usually layers under it. And then making sure that the engagement process is meaningful and it's clear about what level of decision making people have as part of different parts of the process. And then contracting for equity. We're spending money when we're doing these mitigation efforts. We should make sure that that money is being spent with the communities that we usually don't include in the processes and who aren't benefiting fully from the benefits of the work that we usually do. And our processes, God willing, and our efforts willing, will help us to be able to incorporate this burdens benefit analysis to look at how do we mitigate the challenges that are in people's ways of accessing, make sure that those benefits actually get equitably distributed, which we know doesn't happen without intentionality. Right? If we are not intentional about who we're making sure has access, is a part of things, benefits from things, it does not happen. Equity has never happened by accident, and it never will. And then the last piece is once we implement and we're doing the evaluation, that communities are a part of the discussion to determine whether or not we did a good job, right? Our own metrics are important and anchored in a lot of the technocratic side of things, and the community experience and whether or not they think it worked matters as part of that narrative as well. So I'm gonna stop there and say thank you very much. And I will turn it over to Ms. Pat. Thank you for the extra time that I took, and I will be quiet now and say thank you.
No, thank you so much. And without much further ado, Pep, take it away.
No, thanks so much for having me speak as part of this session. And I'm really glad that I suggested that Attia go first, because now I can just take a coffee break and go home. No, honestly, it was absolutely brilliant. And Attia, there's so much that you said that links to what I'm going to say. And so I'm going to try and piggyback a little bit. I don't have slides, and I'll bring a slightly different perspective. So it's from having led an agency that was responsible for this. But just quickly by way of introduction. So I'm Dominican by birth, but I've actually spent most of my professional career working in other parts of the world, primarily in Africa and in Asia. My background just really sort of functionally is in strategy and in systems thinking. But also I operate generally at the intersection of public and private. I was not in Dominica for the passage of Hurricane Maria, so I feel incredibly lucky that I was given the opportunity to actually come back to the island, firstly to live and work there, but more importantly to lead an agenda which is frankly sort of I would say a world first. And for those who don't know, Hurricane Maria effectively devastated Dominica. The damages are still the worst in terms of sort of global metrics, 226% of GDP. In damages and losses, which makes it the single worst climatic event and natural disaster that the world has ever seen in that relative term, right? Not necessarily in terms of deaths, but certainly in terms of impact on the economy and as a result, longer term impact on society. So my mandate as chief executive was to lead the charge to make Dominica the world's first climate resilient nation. Now that's a fairly bold statement, some would believe arrogant and actually even delusional, and I've said that many times. However, I think what was really phenomenal about the statement is that it came from Dominica. It was homegrown, and it was not, it wasn't necessarily, sort of pushed on the country from anywhere else. And I'll tell you why I think that is relevant. And so what did I do? I set up the agency, basically defined the details of the organizational structure, hired people, and then had three functions. One was the strategic function to chart the path forward for Dominica to become climate resilient, and recruited the team that would be on the ground for 4 years, because CREED, the agency's acronym, had a 4-year mandate, and then execute a series of projects, about $350 million of projects. We can also talk about that in a second. Which were supposed to be part of a $1 billion package of programs intended to help Dominica get out of the difficulties of Maria. But many of those projects happen to have actually been programmed before Maria, and they still got lumped into recovery. So again, longer conversation. So the first thing I did was define the categories within the strategy piece of how do we define resilience. It's very similar to actually what Atia has. And essentially said, look, the focus, I got to Dominica, there were posters all over the place, build back better, hurricane ties, blah, blah, blah. And I said, well, better than what? Firstly, better for what, better for whom? And so I said, look, the first category, I think, is strong communities. So very similar again to Atia. The second category is robust economy. And then we have infrastructure, but the infrastructure is designed to support strong communities and the robust economy. But it's not just any infrastructure, it's well-planned and durable infrastructure. I think that within the infrastructure space, my background is in engineering, but I'm really not an engineer. The piece that was missing for me is it's not how you build the infrastructure, it's what you build the infrastructure for and where you build it that will ultimately define whether or not it's resilient. Because if you build a hurricane-proof, building in a landslide area or in an earthquake zone, you don't solve the problem, right? So you're building things in the wrong places and not necessarily even building the right things, let alone how you build them, which is just the standards component. So we have these kind of core understandable pieces, strong communities, robust economy, and well-planned durable infrastructure. But then it's that softer side. So, Atia calls it governance, there's other aspects, but for me, it was what we call sort of transformation or transforming the way institutions work. Again, Creed had a 4-year lifespan. So effectively we had to phase ourselves out. I was there for the first 2 years, but the only way you can phase yourself out is if you phase what you're doing in to the rest of the country, right? Or the rest of the government. And the reality is that Dominica was not going to become climate resilient or resilient in any regard in 4 years. If we could in 10 years, that would already be good. So we had to find a transition plan. The second piece is what we call collective consciousness. Again, it's that human aspect. You're not going to become resilient if people don't want it. And that's not just institutions, it's people. And how do you become resilient when you have a population of young people who are effectively fleeing the country? Not particularly because of Maria, but because it's a small island of 65, 70,000 people. And, I've said many times that this is sort of, previous to the Facebook generation and the Instagram generation and TikTok generation, we had the cable TV generation where you would watch TV and you would see, I always say sort of Beverly Hills 90210, and that's the life you want. So you leave an island to aspire to that life. Well, how then are you going to become resilient when you're losing your youngest, your best, your brightest, your most motivated population? You're losing them to New York, to London, to Toronto, to St. Martin, to wherever. And so the consciousness aspect is also key. And that's not consciousness that you need to stay here, but it is that you need to care about your own resilience. And when you lose hope, why would you care about yourself? And then it's sort of a negative spiral. And then the last piece is, again, people lump it into environment, but for me, it's protecting and sustainably leveraging your natural resources and your other assets. In the context of Dominica, you have blue economy, you have green economy, but you also have a native population, an indigenous population, the Kalinago, which is an incredible asset to the country. How do you make sure that they're protected and leveraged and not just subsumed into the broader culture? So once we've defined these categories, and again, sorry that I'm speaking so quickly, but I'm conscious of time, you said, look, we need to set some targets. And what was clear to me is that no country had at a national level set targets by which they could define having achieved or not achieved resilience. And so that was actually a very complex thing to do. There was a whole bunch of targets that the government had aspired to in every possible domain, but I whittled that down and also added to it to create a set of 20 targets. And those included, and these were signed off by the Prime Minister, 0 climate-related deaths after a climatic event or other natural disaster. So 0 deaths, which is a huge aspiration. About 65 people died in Dominica following Maria. What would be an appropriate number? 7 people, 12 people, 1 person? No, so it had to be 0. But there were also other targets related to economic growth. So 5% sustained and sustainable economic growth, and no more than 5% of GDP in damages and losses. Remember, I said 226% was the impact of Maria. So the government has committed to no more than 5% of losses. So now you have your targets, which is great. But of course, you then have to measure a baseline. And where do you stand at the moment? So again, targets were across 20 areas. But what is the current real GDP? What really is the growth rate? How do we measure how the population is doing so that all the various targets that we set could be delivered on? And this is where you get into the difficult space, data, right? So very limited data in terms of, what roads function, which bridges are damaged, et cetera. But the more fundamental missing data is the human side. I'll give you two examples. One is there has been no census done or officially released in Dominica since 2011. So for 10 years, you don't know what the population is. In between, you have had Tropical Storm Erica, you've had Hurricane Maria, you've had all sorts of things going on in the country. And yet it wouldn't be that difficult to do a census in a population of 50, 60, 70,000 people. We can go into why that hasn't happened. We can also go into what you survey, again, to Atia's point, when you do a census, right? Are you just stacking up numbers or are you actually trying to understand the nature of the population? Which brings me to a second example. By all measures, the number of people registered in Dominica as being disabled, physical, mental, and other challenges is 500. Statistically, it's probably impossible that Dominica only has 500 people with disabilities. But if people don't want to register themselves as having disabilities for whatever reason, there may be cultural reasons, there may be stigma, et cetera, and the government doesn't know how many people have disabilities, you can't serve that population, but you also don't know how many people are below the poverty line. And if you did, you wouldn't want to release that information. So if you don't know how vulnerable your most vulnerable people are, you don't have a baseline, right? Again, to Atia's point. Nevertheless, we had a very, very limited amount of time to define the strategy. And so I still went ahead and said, look, let's outline a series of about 60 critical initiatives that will need to be delivered on if Dominica is going to achieve some measure of resilience. And we narrowed that further down to a top 10. And in the top 10 were a couple of interesting initiatives. One I'm actually quite pleased has gone a long way in being delivered, and that is that the entire government budget, so spending on capital projects, should be aligned with the resilience target. So, speed at which roads and ports and bridges should be open after event, you have to align the budget with that. We also had another initiative, which is in the top 10, which is a CERI initiative, the Community Emergency Readiness Initiative, where we said that every community, about 60 communities in the country, needs to have autonomy for 15 days in terms of access to clean water, basic food supplies, basic medical supplies, telecommunication, and basic backup power. And if you have that, then the community can at least survive. And in a country as mountainous and difficult to sort of travel around after an event like Dominica, having that autonomy is key. And this is great. And a lot of people have talked about that as being a particularly useful initiative. It hasn't been fully funded, and we can talk about, challenges in that regard. But for me, actually, the core piece is a welfare system. And so I put that in actually as one of the top 10 initiatives, saying that you really need to sort out the welfare system. And that starts by having identity cards. You need to know who your people are. What is the status of your population? And how do you ensure that those who fall below a minimum standard of living are brought above that standard? Because there's no point talking about an event if every 999 days between events, people are living a pretty crummy life. How on earth will they survive that one-day event? They won't. So you're not resilient before an event. You definitely won't be resilient after an event, which means that this really kind of takes us to resilience for me, not being about events. It is a fundamental development agenda. It's much more fundamental than what we generally see as a development agenda. I'm at the IFC, it's part of the World Bank Group, but it's actually a much more basic development agenda than that. I'll give you another example. We went to schools to talk to children about how they define resilience. And a particular school, every child was given a little T-shirt drawn on a piece of paper and said, draw on your T-shirt what makes you resilient. And kids are like, oh, because I do this, and because I'm a hard worker, and because I go to soccer practice every weekend. One young girl who was 8 years old wrote on that shirt, and I don't think any of us will ever forget it, I'm resilient because I've been abused since I was 4. So we can let that sink in. And someone made a comment about children. Absolutely. How will you be resilient if you're living in a home where you do not have dignity, be it in terms of food, in terms of access to resources that allow you to show up at school awake and ready to perform, be that in terms of the safety of your mind, your spirit, and your body, right? So I think that's the hardest part of talking about resilience and needing an agency to deliver, because you're talking about fundamental transformation that you as an individual and your agency don't necessarily have the right or the ability to affect. And that ties into, let's not talk about developmental morals, but let's talk about history. There's a reason that there are populations that are more vulnerable, not just by color, but by economic group and by frankly individual household. And it does become an intergenerational issue that will affect your ability over time to become a resilient nation. If we take a step away from that, your resilience or your ability to become resilient from an institutional perspective very much depends on your resources. So not just your financial resources and the extent to which your government has smart people. And I can attest that the permanent secretaries that we were dealing with in Dominica are frankly amongst the smartest. But they were challenged in terms of the amount of time they had to focus on their jobs, the amount of interruption, be it from politics locally or international agencies showing up, be it in terms of their ability to just manage their own time. Many would have to have side businesses because if you're not being paid a decent amount of money or being paid on time, you still need to live. So the resources that you have at your disposal are not your intellectual capital of the countries that we come from or that we work in, but it's the amount of time and energy and space and authority and frankly, independence that individuals have to do the work that they want to do to advance the resilience agenda. But it's also the international or the external agenda. So it's not just, donors coming and kind of taking time, because donors also do need a seat at the table if they're bringing resources. It is the agenda of the international development community. So again, I'm part of the World Bank Group, and the way we operate is with 3-year cycles. At least on the World Bank side. From the IFC side, when we make investments in companies, we have certain targets and certain factors that we need to consider before making an investment. How does that fit with the 20 targets that the country has set? So again, I mentioned at the beginning that Dominica had homegrown, self-defined, and been very clear that Dominica wanted to become the world's first climate resilient nation, and Dominica defined resilience in a certain way. Does the international community meet you on your territory, on your ground, when they say that this is what we believe we should be doing in your country? Or does it become an issue of, well, I see you've got 20 targets, but we have this agenda. Maybe we'll work with you on 2 of them. The issue with that is that resilience is not project size or project wise. It has to be fully integrated to the development pathway of a country. So you cannot say that, well, we want to sort out the roof problem, so we'll try and develop a program and apply to the Green Climate Fund to get the roof sorted out. If you sort out the roofs, but you haven't sorted out how people over time will pay off the roofs, which is linked to economy, if you haven't sorted out why people are building where they're building, which is access to land, then the roof problem doesn't solve the resilience problem. So it has to, again, to Ach's point, be an integrated development approach. And the challenge with multilaterals, be they an IFC or a World Bank or bilateral agencies, is that they very rarely fund your development agenda. They fund projects or programs or sectors. And again, it's difficult to get our targets and others' targets to align. I always give the example of Singapore, versus Nigeria. It is perfectly possible for a country to become resilient and advance its development trajectory. Singapore did it with very little resources. In fact, I would argue that its only real resources were intellectual and a leadership commitment, and still Singapore achieved their agenda. I do believe that small islands like Dominica, like our other islands in the Caribbean and the Pacific and on the coast of Africa, can get there. But the last challenge is delivery, right? Delivering requires the whole of government to operate in tandem, just like I just mentioned that you can't take a project or a sector approach when approaching financial bodies or financing bodies, international development partners. Government also has to speak with one voice, which means that we have to understand that some projects will have to move faster than others. Some individuals will get more glory than others, which brings us right back to the human aspect. But I do think that there's something that I struggle with a little bit more in the context of small islands. We're operating in a very large ocean of big countries. So we can talk about resilience to climate, we can talk about resilience to other threats, but there is an issue of viability of economies that are in the tens of thousands, 10, 20, 30, 40, 100,000 people, where we are inseparable from what's happening around the world. The financial crisis in 2008 woke a lot of people up as to how vulnerable countries are. But I think COVID, in ways that could not have been imagined, has hammered home the threats of dependence on tourism. Barbados, 40, 50, 60% unemployment. Hawaii at 1.70% unemployment. How viable are you? And how long will it take for you to shift your economy away from tourism, when that's not just what you're known for and what your population has been trained for and people expect of you, but also, that's really what you have in terms of resources. So many countries are trying to shift from tourism to blue economy. That's not going to happen overnight. How do you remain viable for the next 5, 10, 15 years that it takes you to shift, let alone become resilient? So I think I'm a glass half full perspective person always, but there are realities that our countries are dealing with that are going to require a great shift in thinking that has to come both from the inside and from the outside, and it has to happen quickly and in tandem. So I'll stop there, and I'm happy to bounce back to you, Kim or Greg.
Thank you so much, both of you. Those were very, very different perspective on this issue of resilience. One from the perspective of the mainland US and all the legacies of the past and difficulties of the present, and the difficulty of trying to remedy those in terms of access to resources and power that have been ingrained in the way that those places have developed. And another one from a small island, I would say closer to the reality of the VI, where some of those boundaries are slightly different and the problem have a completely different nature. And yet both of you are trying to sort of figure out what this ability to resist those shocks look like. And I think there are a fair amount of similarities, which is at the end of the day, really focusing on people and making sure that people have access to what they need to survive and thrive. I think this is really at the end, the common thing, and the how is different for both places. So thank you so much for those very insightful presentation. I just want to open up. We initially wanted to do Q&A after each presentation, but I think it worked really well the way it worked. And I just want to open it up for question from the general audience. So if you don't mind muting yourself, turning on your video, ask your question, and then turn off your video and unmute yourself afterwards. So actually, Mike, go ahead, Atia.
Oh, no, I was going to say, while we wait, there's actually a couple of comments in the chat that I thought would be important to start with.
Okay, go ahead. We can, if you want to start with that, go ahead. But I also would like people to participate vocally. But just go ahead while people formulate their question in their head.
Thank you. And so part of the question, I think there's a premise that it sits on that creates false choices, right? So the idea is, how do we support vulnerable populations and do infrastructure stuff? And they go hand in hand, right? So infrastructure exists in places and where people live, and how we make infrastructure investments matter. The way we do that cost benefit analysis, or the benefit cost analysis, depending on where you are, matters. And what we consider as the benefits of something influences where we place our money in our mitigation investments. And so how we think about infrastructure goes hand in hand with how we think about where the greatest needs are, and how we do that process in a way where we get all of the different domains of resilience benefits: social, economic, environmental, and infrastructure. And then one that often doesn't get talked about, is pretty nascent, is governance, right? And so I'll stop there.
Maybe very quickly again on your last point, actually we do need to hang out or something. The governance piece, that's absolutely right. Devolution of power is critical, right? So if communities don't have the ability or the right or the space or the funding to make decisions on what works for them, obviously they're operating in a broader space. So it's not just like everyone can do whatever they want. But if they don't have that right, then we're not going to solve our problems. And I mean that within the context of Dominique, I mean that at the community level. right? Even in a country of 70,000 people, the communities still know what they need. And even in a small country, having purely central government is very, very difficult. Dominica does have a history of very strong community organizations, but over time, and we can talk about why these things happen, that power has been effectively re-centralized, and that causes issues, and that actually causes bigger governance challenges. It's harder to be accountable when you're not seen, right? A couple of degrees of separation is all it takes for accountability to be reduced and for development, I think, to become less and less appropriate for the communities they're supposed to serve.
Is there another question from the audience? I see the question just popped in. If you don't mind asking the question so that everybody can hear it. No? Right.
So this is the question from Judy Schimmel, just about the 15-day goal for self-sufficiency after a disaster.
No, absolutely. Yeah, I wasn't community manager. That was actually me. Yeah, I came up with that target. Sorry. And again, it's not the right number, but I think it's indicative, right? It's like, look, if it's 12 or 20, it doesn't really matter. The point is that you have to have resources. Ideally, it would be 7 because you wouldn't be locked away for 15 days. But I think that this is where the numbers become a little bit arbitrary. And what's more important is that you're saying, listen, this is about having autonomy. We, of course, socialize these targets and discuss them with a number of people. And they're like, yeah, okay, that's fine. That sounds about right. We said 2 weeks. But also a lot of it was based on historical. So how many days after Maria and Erica were communities cut off from? And in an island the size of Dominica, really, you should be able to reach most communities around the coast very quickly, but there's no ferry system. There are no boats to go around. And then the boats that you have are damaged during the hurricane. So we basically looked at the worst case for inland communities. There's one road. If that road is cut off, let's kind of measure. But I will admit that the number is exact number is a little bit less important than saying we need to put resources in those communities so that no one dies from a cut because there was no basic medical equipment available, right? Or no one gets an infection because there isn't a nurse who has access to basic resources in a community after a storm.
So there's a question from Kimiko. Kimiko, do you want to ask your question? No. All right, so the question is, what is the level of civic education and engagement in Dominica?
That's a good question. I think it is, well, I hope it's increasing after the work that we started to do, but I think it is variable. It's variable in ways that you'd say, look, the young population should be the most aware of some of the basic things. However, I'll give you another concrete example. There was a tourist. I walked past a tourist when there were tourists and cruise ships. And there are not even that many in Dominica, standing in a corner and taking a picture. And I was like, wow, I wonder who's taking a picture of? There's nothing there. And I heard him talking to his partner saying, this is a nature island. Look at all that trash, right? No excuse for that type of behavior. The number of young people I would see flinging things, slinging things in their own communities. The number of people I see, again, island, this is not just Dominica, this is all over the place, burning rubbish, trash, including plastics next to their home when their children are asthmatic. That's not a lack of awareness. I don't know what that is. I don't know if that's laziness. I know that part of it is lack of enforcement of laws, but you yourself should not want to be breathing that in. So I would say that people know and their engagement is variable, but a lot of your engagement depends on how well you're doing as an individual. Do you have time to now take your trash down the hill? Do you have time to scream and shout when the garbage people didn't come and collect? Do you actually feel motivated? Are you suffering from low-grade depression that means that you don't really care if you throw things around in your own neighborhood? So I think that it's hard to talk about it generally because it boils down to the individuals, but there are communities that are incredibly proud and incredibly strong and incredibly effective. But I would say that the engagement varies very much across the island by community, and that's determined by a number of factors, including how well the community is doing financially.
So there's another question for both panelists, because it seems that people prefer to use the chat, which is okay. Question for both panelists. How does how did the pandemic impact and shift your perspective? I'm just gonna put then my little observation in that question since I'm talking. I just came from there was a previous meeting that I was in where they were talking about how resilience for the built environment meant to be able to recover the function. And so they were focused on, office buildings and making sure people can go back to work. And my thought was, the pandemic really decided this idea that we need an office to get stuff done. So anyway, just wanted to kind of get your sense, looking at infrastructure, communities, access to resources, et cetera. How did the pandemic shift your perspective?
Actually, would you like to go first?
Sure, thank you. Appreciate that, Pep. So on several levels, some of them positive and some of them negative. So the positives are, which is hard to say there's positives in a pandemic where millions of people have died. But the positives are people were able to come up with the types of solutions and quick action that we used to say were impossible, right? We can't have people just working from home, like that's crazy. And it's like, okay, well, now people are working from home, and so it's not that crazy. Then you have to think about the equity implications. How do you make sure that all employees have access to what they need to thrive at home? From an emergency management perspective, I think it brought awareness to the issue of pandemics and the realities that we could have to shelter in place for extended periods of time. And what does that mean for us in our communities and the kind of resources that we'll need to have or to collaborate with other people, our communities, in order to have. And then more on the negative side, I felt like I was in a warped melding of the Twilight Zone and Groundhog Day, because it felt like we know that people disproportionately burdened before are going to bear the burden of COVID-19. We know this, again, intellectually. All of the behavior was the opposite. Where resources for vaccinations were placed, where resources for testing were placed, where if you map them out across many places around the world and even in the United States, they were in areas where the greatest impact was not. Right? So we placed all these resources where they were not most effective, which is the opposite of best practices that we know work for public health preparedness and response, but also from a traditional problem-solving perspective. If a house is on fire, you don't put water on the house next door. You put water on the house that's in front of you that's burning, right? And so it felt like this, like what many folks who came long before me and folks like us in this space have said around how we know we need to be moving, what's documented on paper in terms of the best practices, but we did not follow the best practices and therefore worsened the situation in marginalized communities, and then said, oh, by the way, we're going to berate you for not getting vaccinated quick enough, even though we didn't put enough resources in your communities for you to get access to vaccines. And we're going to declare victory, like we're done with this whole COVID-19 thing. And this is an American context. But when we know that there are pockets all across the country and even within jurisdictions or states where we've said, we have these great numbers and we're going to move forward, but the inequities are in the details. When you look beyond these macro levels and you look at the details of a state, of a city, you begin to see the inequities of who's vaccinated and who's not. And it's not just because of hesitancy or I don't want to get vaccinated. The data shows that larger percentages of people of color and poor people want to get vaccinated than actually have access to get vaccinated. And so there's a lot of barriers in their way. All of that to say that it felt like being in those two spaces, Twilight Zone and Groundhog's Day, because I feel like, you know, every disaster, we have the same conversation, whether it's a slow moving disaster like climate change or whether it's a pandemic. It's exhausting. It really is exhausting to watch people die unnecessarily because we intellectually know things that we don't put into practice for lots of reasons that I understand intellectually, but it doesn't make it any less frustrating.
For me, I'll try and be brief. I think firstly, Dominica, the government did an incredible job at responding. I was in Dominica until until end of July last year. So for the first third or so of the pandemic, I think the government actually showed that it is able to respond. Very, very stringent rules. We were essentially on lockdown for like 4 months, and the fines, you get serious fines if they caught you out. And the population responded, I think in general, very well. They were pretty good about adhering, both of which I think were very, very big positives for me. I was very happy to see that. A lot of kind of discipline and what worries me is, as I mentioned earlier, the longer term impact, and this is not on Dominica, this is on small island nations in general. We can talk about the Maldives, we can talk about Seychelles, countries that, let's look at the Seychelles, which has a huge dependence on tourism from South Africa, and South Africa is a mess. So, economies are crumbling, they're crumbling. And I don't need to speak to half the people here who are in the island. So I think I'm actually very, very concerned. In a way, resilience for me, I'd always actually said before COVID hit that for Dominica, resilience is not about climate. It's about all the other things, including health issues. So when COVID hit, I was like, geez, I don't know how we're going to get out of this. But the other thing that's concerning me is the politics, the geopolitics, the influence of China, the influence of India, the influence of Russia, the influence of all sorts of people. I think it's fantastic that many of our small islands had access to vaccines early on, but there's geopolitics at play there. Who gets what, when they get it, how they get it, who they get it from. And so I think what it has reinforced to me at a more macro level, at a national and regional and island brothers and sisters level, is the vulnerability, not just economic, but political. And I worry, I'm actually very worried in a way that I wasn't as much before.
No, that's very interesting. This link with the economy is something that also was a surprise to us working on a hazard mitigation plan. Started, and I think one of you mentioned at some point the concept of hazard becomes almost irrelevant when you look at the enormity of the task to just get to the minimum. And I think, at TIA, it's probably the same that you observe in some of the communities that you're working with, where it's like, I think you mentioned a hazard, but my life is terrible day to day in, day out. So a hurricane is just yet another sort of, issue that I have to deal with. But this issue of the economy and having a strong economy in order to really be able to be at the table, if you will, in terms of looking at how to become resilient, how to ensure that services are delivered, is something that was a bit of a surprise to us entering in this effort. And then the question of, as a small isolated nation or as a small isolated island, and as a small communities that don't have access to all the resources, how do you even keep up with the rest of the world? Because from a technology point of view, the computers keep evolving, the connection to the internet now is essential, high-speed internet is essential, all the evolutions of just appliances that require all those connections, from a communication electrical point of view that didn't exist before, I think for me are also very worrisome in terms of the ability to just keep up and be able to just keep up with the demand, because we are dependent on others for all our resources. So anyway, that's a very interesting point that you both made. But I just want to ask my question, which is, what do you think about the ability of the government? So, remembering your days working for the government, looking at it from the outside right now, how can government even deal with this? I mean, Atia, you were expressing your frustration with the fact that we keep doing the same thing over and over again, and yet you have conferences and webinars like this one where things are said over and over again, and yet it seems that on another side, on the practical point, are we making progress? So looking back at your days at the government, what were the good things and where were the sort of things that you want to raise as, okay, this is what you need to pay attention when you talk about, putting in practice resilience?
So I see that Pep has to hop off in 5 minutes, and so I'm going to defer to her. 3 minutes now.
Thank you. I'll be quick. No, I think it's very simple for me. There is a mismatch between the resilience timeline and election cycles. Your resilience is a long run. It's a long game. That's a 10, 15-year set of decisions around investments that you need to make in people, which take time and don't necessarily show, and in infrastructure, some of which things like slope stabilization is not going to get you reelected, right? Things like seawalls may help protect a community and be very visible, but that might not be the best use of a very large amount of money. Maybe you should be doing, coral defenses. So I think that the challenge is a mismatch in timeframes. I think at the individual level, again, when you look per sector, the sectors are generally doing the best they can. I mean, ministries know what they need to do, whether or not they have the resources and whether or not they're given the resources, let alone whether or not they have them in the treasury and the coffers. But if they're allocated resources, I think can make a very big difference. And I think in small countries, infrastructure projects, small island economies, infrastructure projects are very expensive. How you do them, who does them, when you do them, if you do them, can make a huge difference in the resilience agenda of a country. So if you do the wrong project, and that's a $300 million project, the implications will be decades long. It's not like you have another 2 billion that you can use. So yeah, so you need to make sure you're doing the right things for the right reasons, and that doesn't always align with election cycles. That's a good
Thank you. Thank you for your participation.
Thank you so much for the opportunity.
Thank you.
I just want to thank you so much for being here today. Atia, your answer?
So I'd say the great thing about government is it attracts a lot of mission-driven people. And so there are a lot of folks who are invested in doing good in communities. I think the other positive thing about government is when it's operating in a healthy way, it really has the ability to really change the lives of lots of people, right? In partnership with community, which leads into the challenge. Oftentimes, because of political cycles and timelines, government is not focused on these longer term trajectories, right? The people are worried about, mayors are worried about elections, governors are worried about elections, legislative folks are worried about elections, depending on what position they hold, every 2 years, every 3 years, every 4 years. And so it really becomes incumbent upon the folks who are not elected officials to hold the mantle of the long view, which is really hard because now you're constantly having to speak truth to power. And when your job is on the line, that can be a hard decision trade-off to make, right? I could speak up and risk losing my job, or put my head down and not say anything. And there's things in between. I'm creating a bit of a false economy. There's a spectrum of things that can be done, but all of that to say that's a reality. And then the role of community. Oftentimes, because there's not enough resources and because of the rigid hierarchy of government, oftentimes our thinking becomes constricted in the ability to be creative and to think beyond the limitations of what government can do. We oftentimes end up saying why we can't do things as opposed to working in partnership with folks to figure out what are the things we can do. How could we approach something like this? And how do we do it in collaboration with community? Because just like for us in the resilience space, where the content experts and the communities are context experts, it's the same thing with government and community. And I think a lot of times because of those fast timelines and limited resources, people tend to think of the community as an afterthought. And what we end up doing is we come present to them what we've already come up with well after the fact, and then we get mad in government because then folks poke holes in what we've come up with. Well, what about this? Well, why didn't you consider this? Or, you know, lots of things that had folks been involved at the beginning of the process, we wouldn't have ended up at those decisions. And then the last thing, on a very practical mitigation perspective, that's positive. That's a positive and a challenge is when we're working on prioritizing infrastructure projects, making sure that we're taking into consideration this more systems approach to this interconnected world that we live in, and bringing in some of the social vulnerability considerations as part of that analysis. And so I'm doing some work with a region in the United States on how do we do a critical infrastructure assessment with infrastructure managers. So we did a tabletop exercise and kind of walk through some of what their challenges are. And then we did a social vulnerability assessment and did surveys with folks who are in the very communities that we're talking about, did focus groups in different languages, focus on communities that we're talking about, and then making a proposal about how do you integrate these two things so that if I'm looking at both together, I see something different than if I look at one by itself. So that my infrastructure investments are informed in a way that has the broadest benefits to communities. And then the last thing I'll say on this front, we think about critical infrastructure as being disconnected from people, and it's oftentimes not. When we think about who we learned were the essential employees, right? They were oftentimes people in marginalized communities, which was part of some of the reasons why we saw these increased numbers. But those are the people who work for a lot of the critical infrastructure folks that we are thinking of, healthcare and food and all of these different pieces. These are the folks that we're talking about. And so there is a relationship, even from a business continuity perspective, of understanding the intersection of the social vulnerability piece with infrastructure, with environment, and with the economy. So I'll stop there because I've been talking too long.
No, thank you for this really good answer. So just want to see if anybody has one last question. Anybody has one last question?
Yeah.
Go ahead, Kim.
So I regret that Pep had to step off because after hearing both of the presentations, I really have a sense that the USVI really captures the challenges you characterized in Boston with the small island realities that we see in Dominica. And so it's like in some ways, we feel like we got the worst of both scenarios in some instances, as far as, you talked about, Boston, as diverse as it is, it has a staggering amount of resources in the context of intellectual capacity, on and on and on. There's people, training, staffing, et cetera. And so your issue is something that Dominica and the VI struggles with, is retaining, that overcoming that brain drain, or best and our brightest. You, in contrast, have people coming to Boston to advance their careers or gain new skills or contribute, while they're advancing their lives. So I think what challenges me is to try and think about, around the things that are around governance, because I think Greg and I and others on the HMR team, there's reference to strong governance, and what does that look like, especially when resilience flows over multiple election cycles. And if you had to sort of prioritize, is it the one voice, or is it a strong individual leader, or is it just key people in key places that can be champions I mean, help us understand what you've seen, whether it's in Boston or other, places. What gets traction when, you have a cascading list of, inequities, legacies, like you do in the mainland and here, but also the remoteness and small rural context of the islands here in the Caribbean.
Thank you for that question in that context. The quickest way I can describe it is there are actually parallels with the quote unquote brain drain in Boston, in the sense that we see a lot of organizations in Boston wanting to recruit more people of color, but people of color don't want to move to Boston because of its history
Right.
and in present day realities. Even though it's very diverse, even though we're more than 50% people of color, most people outside of Boston, outside of Massachusetts, don't know that. They see it through this very narrow lens. All of that to say, so we face some of the similar challenges with Black people in Boston, Latinx people in Boston, the whole range of folks who then want to leave because it's not considered a place where you can thrive as a person of color. And then from a infrastructure, in terms of how do you prioritize, what would be an issue that people can rally around? So the way I think about it is kind of twofold, and the best way to describe it is the biggest gap that we have in America and in the world really is the wealth gap, right? And so the more that we can connect the dots between how what we're doing is going to help address that, people can rally around that. And so one of the things, concrete example, would be when I was the Chief Resilience Officer, we had a very intense community engagement process. I had no budget to do this. So I had to leverage relationships with community organizations to make it happen. But we engaged over 12,000 people in the city with an office of 2.5 people and some interns. And we did that through those partnerships and through framing resilience in a way that was relevant to people's day-to-day lives, right? We didn't say, oh, climate change is coming and like all of these things that feel disconnected for people in the community, connected it back to, we can create more jobs, like we can address, we can increase the value of our properties that we own. Like these are the things that we can do. We can increase business ownership because we know we're going to need more businesses that can retrofit homes, right? So this whole range of how do you anchor it in a meaningful issue, and with the wealth gap being something shared, I think it's a tangible way of getting lots of people across community engaged, not just the individual people, but also businesses, nonprofits, government, to fully embrace this kind of conversation.
All right, thank you.
No, thank you. So, do you want to close, Kim?
Well, no, oh yeah, happy to. So again, great presentations. You can see the comments and appreciation noted in the chat. I actually could spend another hour or two just because I think, we're getting closer and closer to actual real examples of implementation and strategies. You touched upon some of them, but maybe we'll bring you back and we can actually drill down a little bit. I don't know, but if you're open to that, we might consider it. But all in all, I think we had a really good overview from two different perspectives, and yet, as both Adja and Pat mentioned, there are some parallels. There are some common ground that that the importance of people in driving, especially people that are going to be impacted by these decisions, and that's something that I think Greg and I and the rest of the team really take seriously here. Our approach of looking at this resilience component in the hazard mitigation planning effort is threefold. It's, yes, there's the infrastructure. We know we have to deal with that, but it's our natural resources and the sustainability and maintenance of them. And then the communities that they're ultimately the metric as to whether you are truly resilient. And all of that, unfortunately, especially in small island states, is driven by the state of our economy, which is, at threat because of all the reasons articulated, but because of our scale, our size, and our exposure to major trends or patterns like COVID or an economic downturn. So we are we're like a small boat in a very large body of water that's just being pushed around. And yet within that, we have to figure out ways to be more self-reliant and self-resilient. That starts with our community, starts with that engagement, and then hopefully it works its way bottom up. And just based on what I heard, I think there's a strong bottom up opportunity, but that does take a lot of work. But I want to thank you both and the audience for joining us. This was fantastic. Thank you.
Thank you.
Thank you.
Appreciate it.
Have
Have
a
a great
wonderful rest of your week, everyone.
you too.
Bye.